What is an ACL injury and why is it a big deal? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Now, one of the most common operations we do, at least in the sports medicine part of orthopedic surgery, is an ACL reconstruction. Just in the United States, we think that somewhere between 100,000 and 200,000 ACL reconstructions are performed every single year. And there's far more ACL tears even than the ones that we fix surgically. And you know, it's a real problem because it's a surgery, as we'll talk about in future videos, that requires not just the surgery, but months and months of rehab. Sometimes can take a year or more to get back to sports and exercise the way you were before you got hurt. So it's worth talking about what the injury is because, you know, if you don't know what it is, you don't know why it's potentially a big deal until you tear it. Basically, the ACL is the anterior cruciate ligament. This is a ligament in the center of your knee that provides stability to your knee. It prevents basically not just front to back motion, but rotational stability of the knee. And that can be a real challenge when you're talking about playing sports or exercising because you go to land from a jump or you go to plant your foot and turn and the knee can give out if you don't have an ACL tear. And that's where it's really challenging. That's actually, those maneuvers are typically how you tear an ACL. Yes, you can have a player roll into your knee or tackle you and hit you on the knee and that can tear your ACL. But that's actually not the most common way. Roughly 70% of the time, it's from a non-contact mechanism. Again, you go to land from a jump and you land on your foot, your knee's all the way straight or even a little hyperextended, and you land awkwardly, you feel a pop, basically your ACL tears, you buckle to the ground, and yeah, you've torn your ACL. Or you may be running straight ahead, you plant your foot to turn and change directions, your foot stays planted, your foot twists, you feel a pop, and you've torn your ACL. And when we say a pop, we're talking about a loud, very painful pop. A lot of times people say that their teammates, say that they heard that pop. Another thing you might see is the knee swell up really big right after it happens. That's actually really common. The knee fills with blood. And we're not talking about just, hey, it's a little swollen. I mean, basketball or volleyball, sometimes size swelling, a noticeable difference compared to the other side. This is a big deal because ACL injuries don't heal on their own. We're going to talk about, do you need surgery or do you not need surgery in the next couple videos in this injuries and surgeries series on YouTube. But I think it's worth talking about the fact that they don't heal on their own. If you have, a complete ACL tear or what we call a high-grade partial tear, that ligament isn't going to heal on its own. There's a variety of reasons that doesn't happen, but it just doesn't work. Now, that doesn't necessarily mean you need surgery or not, but just wearing a brace, just giving it time isn't necessarily going to make that better. Yes, your swelling will go down, your pain will go down, you'll get your knee motion back, you'll slowly get your strength back after the injury. That's not the problem with a torn ACL. The problem with a torn ACL and basically a chronic ACL deficiency in the knee if you left it without surgery is instability, that it can buckle or give way. Not in everybody, and we'll talk about who potentially doesn't need surgery in our next video, but that's one of the big challenges for an ACL injury, and it's why so many people undergo surgery for an ACL tear. Have you suffered an ACL tear, and what did you do about it? Did you have surgery? Did you try to treat it without surgery? I'd love to hear your experience. Below this video, tell me what happened. Tell me what the injury was, what you did about it. I would love to read it, and I know people all over the world would really get value out of that as well. If you like videos like this and you want more information on injuries and surgeries, regardless of your sport or regardless of your exercise, I record a couple of these videos every single week. Click the subscribe button in the upper right corner of the YouTube page and you'll get those videos delivered directly to you. Thank you so much for watching. If you know somebody dealing with an ACL tear right now, please share this video with them because I really hope that it helps as many people as possible. Thank you so much for watching, and I look forward to seeing you right here next time.